My friends, no preventive cardiology lecture series would be worth a drip if we didn't talk about lifestyle. So I'm going to reference it, but I'm not going to spend a lot of time talking about it. I come from the perspective that you know this stuff. You know that people shouldn't be drinking Coca-Cola and eating candy bars all day long. They shouldn't be sitting on their couch and staying up playing video games all night long. They should try to tone their stress levels down. This is where lifestyle factors in, and I've added that as an ever so small summary at the end of our roadmap because you already know this stuff. So I'm just going to take 5 minutes and mention it. I already told you the experience of being on an airplane and watching the little kids next to me order Dr. Pepper and Sprite. And so I took the mini pretzels and I looked at that mini pretzel and I scanned it in. This was just on Saturday, right? So I just scanned this in and looked at this. The screen is actually too small for you to see it, but if you could see the ingredients, it's so fascinating to me. It's white enriched flour, and then they fortified it with thiamine, which is vitamin B1, folic acid B9, and B12, and a little bit of magnesium. Why? Because they're going to make it healthier. And then look at that Dr. Pepper right there in this 9-year-old boy. This is the standard American diet. This is how most people eat. And so you have to really be dialed in of saying, what do we do for lifestyle? This is the handout that I give to my patients. And you could just print this slide off and give it as a one-page summary. The first one is I've told them, you got to get light exposure every single day. Wake up first thing in the morning and expose your eyes to bright light. Go on a first morning walk. Get that bright light because it's going to change melatonin in the brain, stimulate a wakeful state, and that circadian rhythm will predict that we get better sleep at night. Whenever someone says, Randy, I can't sleep at night, I usually start sleep hygiene with what they do first thing in the morning. Don't wake up in the morning and walk around in a dark house and keep the windows covered and drink your cup of morning joe until 10 o'clock in the morning before you get light exposure. Do it first thing in the morning. It'll make a difference for you. The second thing, I already talked about that, is people got to get good sleep. It needs to be high quality sleep that's very consistent. And the more people can go to bed and wake up at the same time, the better off they are. We got to track for obstructive sleep apnea, and sometimes wearing a wearable like an Oura ring can make a difference at helping to predict sleep. The second thing is diet. Diets probably should be number one. It's hard to know where to classify these because each patient has different triggers. I always recommend a continuous glucose monitor, and I'm trying to get my patients to eat more fiber. I'm begging them to get rid of processed foods and cut sugar out. And my threshold is I'm asking my clients to get 100 grams of protein a day. Now, I'm asking them to get 100 grams of animal protein because we have all those patients that say, oh yeah, I get 80 grams of protein every morning with my workout because they're drinking whey protein. That's not what I'm talking about. Whey protein, when consumed in a protein drink, has a physiological effect like drinking Kool-Aid. And if you don't believe me, then wear a continuous glucose monitor and drink a protein shake. This response is amplified in the individuals who have prediabetes, insulin resistance, or hyperinsulinemia. 100 grams of protein is only 400 calories. That's it. So you could take your little exerciser wearing Lululemons that only weighs 120 pounds, these cute little California girls that look amazing, and they're only eating 1,000 calories a day, 1,100 calories a day. 100 grams of protein to them is going to feel like a lot, but it's only a third of their total caloric load. When you help people to understand this and they're really understanding how diet affects their body, my gosh, it can actually change their lives. I encourage no grains or limited grains. I myself am not 100% grain-free, but I'm pretty reduced. I think that's something that helps us stay physically fit. It helps us to keep weight down. It keeps our blood sugars down and so forth. Stress reduction, man, I don't know how to encourage people to do this. This is probably the most difficult thing is people come in and they tell me what's going on in their lives and it's heartbreaking. It's so difficult to know how to manage. What I tell my clients to do is to be intentional. Have carve-outs in your day where you sit down and turn off the music and you put your smartphone down. Listen, Mindfulness is not incessantly scrolling through your Instagram account. That's not being quiet. Put that down, settle your mind, do some deep breathing, do some Tai Chi, make it very intentional. That's basically how I counsel with people to try to manage stress. Exercise is totally non-negotiable. And if someone can't get an hour of exercise a day, then I ask them to go on a short walk after every meal. So they eat breakfast, 15-minute walk. They eat lunch, 15-minute walk. They eat dinner, 15-minute walk. My wife and I do this on a regular basis. It works really well in the summertime because the evenings in the summer are amazing. So it's amazing to go walking. Down here in Southern California, it's amazing to go on a walk outside. It's pretty hard when the snow's blowing sideways and it's 20 degrees in a gray sky. At our house, we just have a treadmill and we'll eat. And my wife and I will say, who's first on the treadmill? 15-minute walk. It actually changes your blood sugar and your metabolic health. Hormesis is a stress response. It's amazing how much inducing a physiological stressor like through sauna or through cold plunge or through exercise with oxygen actually can change physiology and strengthen the autonomic nervous system. Dental health, man, I gave a whole lecture and discussion, but it's a part of lifestyle. I don't think we can create a good preventive cardiology program without good dental health. And anyone who's had a root canal should get a cone beam CT scan of the mouth. It's one of those panel dental x-rays that you do, but the nice thing is the resolution on a cone beam CT scan trumps plain film x-ray. So you've all seen plain film x-ray. It looks like a freaking Polaroid camera shot versus a digital x-ray. And people who have a long-standing root canal are at a high risk of having a cavitation or a chronic inflammatory response down in the bone that they cannot feel because the nerve was removed. That's what a root canal is in the first place. So a cone beam CT scan is definitely a part of my prevention program. And my friends, alcohol is the new tobacco. For years and years, you guys probably remember this. Remember all of the tobacco executives testifying before Congress that tobacco does not cause cancer. It is not carcinogenic. There's been no research. Do you guys remember that? It was like the late 90s, early 2000. We all knew that was a crock of bull. Tobacco sucks and it's terrible for the human body. I am predicting that in very few years, alcohol will have that type of press. Alcohol is not good for the body. It's not good for the body in moderate amounts. It's not good for the body in big amounts. And we've got sucked into this methodology of believing moderation in all things. It's not true. As healthcare providers, we say moderation in all things to justify our own use of alcohol. I'm speaking candidly, not judgmentally. I don't look down on people. I don't think they're terrible people if they have a beer or they have a glass of wine. My point is, we should be clear about the science. Alcohol is a toxin, and a toxin in small amounts is still a toxin. That's why people get intoxicated. So any opportunity that I have to see, could you tone it down a little bit? Could you reduce it to 1 glass of wine at night? Could you reduce it to 1 glass of wine on the weekends? Hey, if you're only using it once on the weekends, why use it at all? What's the point? My friends, I like a candy bar once in a while. So I don't want to be a hypocrite and tell people, never eat a candy bar. That would be hypocritical. But my point is, I'm very clear that candy bars are not very healthy. And I don't say moderation in all things. No, I should just be clear. Candy bars are not very healthy and I shouldn't eat them. I feel the same way about alcohol. I think it's problematic, and I hope that as a medical community, we can do a better job at talking about the facts without being judgmental or without being criticized about having that opinion that is just not very good for our bodies. That's how I approach lifestyle interventions.
Thanks for listening to Solving the Puzzle with Dr. Datis Karazian. Start your 7-day free trial at KarazianInstitute.com if you're a licensed healthcare practitioner ready to evolve your functional medicine practice. Explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.